All right, everybody. So we're going deep today on a topic that, well, let's face it, a lot of guys kind of tiptoe around. Prostate health. But guess what? This guide, Prostate Health, a guide to prevention and wellness. It's like the ultimate cheat sheet.
Yeah, it's amazing how many myths are out there. But honestly, you can really take charge of your prostate health.
And that's what we're all about here, right?
Yeah.
Giving you the knowledge to take action. So let's just jump right in. First off, the prostate itself, it's tiny, like a walnut, right? What's the big deal with this little gland anyway?
It is pretty small, but it plays a big role. Think of it as the behind-the-scenes guy making sure everything's good to go, if you know what I mean.
If you know what I mean.
Right.
Makes fluid for sperm, right?
Exactly. Part of the seminal fluid, crucial for healthy sperm. But here's the thing. It's tucked at a pretty awkward spot. Between the bladder and the rectum.
Oh, yeah. Sandwiched in there. Which probably explains why there's so many potential problems. Speaking of which, let's break down those big three we hear about. BPH, prostatitis, and of course prostate cancer. Starting with BPH, what are the signs that something's up?
So with BPH, the prostate, it's like it gets a little too big for its britches as we age. Starts squeezing the urethra, that tube that carries urine.
Yeah, not a good situation.
Nope. So if you're running to the bathroom more often, especially at night, or you feel like you can't quite empty your bladder or the stream is weak, that's when you got to start paying attention.
So basically those late night bathroom trips might not just be a normal part of getting older.
Could be a sign of BPH. Worth getting checked out, especially if it's messing with your sleep or your day-to-day life.
Good to know. Okay, so that's BPH. What about prostatitis? Sounds kind of scary.
Prostatitis is basically inflammation of the prostate. Sometimes it's caused by bacteria, can cause pain burning when you pee, and even some guys get flu-like symptoms.
Ooh, yeah, that's no joke. And then there's the big one, prostate cancer. What can you tell us about that?
Well, the tricky thing is prostate cancer, it can be pretty silent in those early stages, which is why screenings are so important, especially for guys over 40. Early detection, that's the key.
Makes sense. Okay, so let's shift gears a bit and talk about prevention, because this guide is packed with tips. And I've got to say, the diet stuff, that's what really caught my eye. What are some of those prostate-protecting power foods we should be loading up on?
Tomatoes are a great place to start. They're full of lycopene, an antioxidant that's been linked to a lower risk of prostate cancer.
So we're talking like tomato sauce pasta, even pizza.
Well, in moderation, of course.
Right.
But yeah, cooked tomato products, they seem to be the best bet because cooking helps release more of that lycopene.
Interesting. So more lycopene from cooked tomatoes. Got it. What else should we be putting on our plates?
Omega-3 fatty acids are another big one. Those are good for your heart and brain, but they can help fight inflammation, which is good news for the prostate, too. You can find them in fatty fish like salmon or flax seeds and walnuts if you're looking for plant-based options.
See? I told you those omega-3s were good for something. What else? Keep those prostate-friendly food tips coming.
Don't forget about zinc. Pumpkin seeds are a top source. Chickpeas nuts, those are good, too.
Okay, you've convinced me. Snack time just got a whole lot healthier. Now, we can't talk about diet without mentioning the usual suspects, red meat and processed foods.
It's true. Diets high in those things, they've been linked to higher risk of prostate problems. It's all about balance, right? You don't have to go cold turkey on burgers, but focusing on a whole foods diet, that's the key.
Balance, not deprivation. I like it. Now, what about hydration? How important is that?
Super important. Water helps flush out toxins, keeps everything running smoothly down there. Definitely crucial for a healthy prostate.
Okay, so we're talking 8 glasses a day, right?
Aim for that, yeah. Especially if you're exercising, which is another key piece of the puzzle.
All right, so we got to get moving too.
Even moderate exercise, like a brisk walk, swimming, cycling, it all helps boost circulation, and that's good news for your prostate.
What about those Kegel exercises I've heard about? Do those really make a difference?
They do. They strengthen those pelvic floor muscles, which can help with bladder control and, maybe even give your sex life a boost.
Bonus.
Yeah.
Okay, so it's not just about hitting the gym. It's about those targeted exercises too. What about weight training? Does that play a role?
It does. Lifting weights can help keep your hormones balanced, which is important for prostate health.
So it's like a whole body approach. Exercise, diet. What about stress? I feel like that plays into everything.
You're right. Chronic stress can take a toll on your prostate. Finding healthy ways to manage it, like meditation, deep breathing yoga, can make a difference.
So important. Okay, we covered a lot of lifestyle stuff, but what about getting checked out by a doctor? What are the screenings men should be aware of?
The PSA test is a big one. It's a blood test that measures prostate-specific antigen levels. It's not perfect, but it can be a good indicator of potential problems.
And then there's the DRE, the digital rectal exam. I know some guys might be a little hesitant about that one.
It's understandable, but it's quick, relatively painless, and gives the doctor a chance to actually feel the prostate for any abnormalities. These screenings, along with regular checkups, are just essential for staying on top of your prostate health.
Can't argue with that. All right, last but not least, I got to ask about those everyday habits. Coffee and alcohol. How do those affect the prostate?
Both caffeine and alcohol, they can irritate the bladder. Moderation is key.
So maybe swap that extra cup of joe for a glass of water.
Exactly. And if you smoke, quitting is probably the single best thing you can do for your prostate health. Smoking is linked to a more aggressive form of prostate cancer, so keeping the habit is a huge win.
Great advice. So we've covered a ton of ground today. If you had to leave our listener with one key takeaway about prostate health, what would it be?
Be proactive. You have the power to make choices that support your prostate health. Whether it's diet, exercise, stress management, or getting regular checkups, it all adds up.
Couldn't have said it better myself. This deep dive is just the beginning, right? It's about taking action. And this guide leaves us with a great question. What one small change can you make to your eating habits this week to support your prostate health? Could be adding some tomatoes to your dinner, swapping out a sugary snack for those pumpkin seeds we talked about. Every little bit helps.
Absolutely. Small changes can lead to big results.
Knowledge is power, but action is what makes the difference. So take charge of your health, folks. We'll see you next time for another deep dive.